Welcome to Let Go, Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson.
Good morning.
Good morning, Dr. Spiller. So today we're talking about sex.
Yeah. It's a good thing. It's a good thing for us to talk about sex because we really need to talk about sex with our clients.
Yes. And I don't know about you, but I've learned that couples do not bring up sex. Just spontaneous. Some do. I will take that back. Some definitely do. But I'm guessing the majority of couples don't bring it up unless I explicitly bring it up. And that makes sense because talking about sex is taboo. Being open about sex is taboo in our culture. So, and I think there's our level of comfort as a therapist talking about sex with our clients is probably about how comfortable and how much our clients are going to bring up sex in our office. Is that your experience, or what has?
Yeah, well, I definitely learned the hard way that my assumption that if it was a problem, people would tell me about it, and yeah, I kind of learned that the hard way. And I can even remember one couple where we had worked through their cycle and they were de-escalated and we had great bonding conversations. We'd even done some stage 3 stuff. And, I was thinking about wrapping up and they were literally said, well, when are we going to talk about sex? We haven't had sex in years. And I'm like, oh my God, I cannot believe, I did not fully assess that,
Yes.
They didn't mention it. And of course, right? Of course, if you've gotten to that level of disconnection, it's going to impact the sexual relationship. I think I was the misperception too, that when you heal the bond, that the sex is going to come back online. And I certainly see that happen lots and lots of times, but you can't assume that.
Right. And if they're having specific sexual problems, that they feel comfortable talking about it, that they are talking about it with each other. Yes, I can't agree more that we cannot assume. And I think for the longest time, I probably am like a lot of couples therapists because we get almost I don't think I got any sexuality training in my graduate program. And that's true of most couples therapists, most therapists in general. It's just this huge void area for us. And if we don't go and seek out education ourselves, we don't have it. So I was, carrying around the taboo feelings, all the bias, all the stuff that I had just, developed as a person in our culture, and then brought that into therapy, which meant, I don't know how to ask about this. I don't want to make you uncomfortable asking about this. Okay, do you have sex? Maybe I would ask the very minimum questions. And I remember giving, doing one of the EFT trainings, and I brought the couple, and the trainer asked, okay, so tell me about their, sexual relationship. And I had asked in the very beginning about their sexual relationship, but now it had been several months in, and I was like, and I was totally called out, and it sucked. And also it was like a wake-up call. I can't just ask about it once and check a box and I'm done.
Yeah.
I have to be much more intentional about asking couples, and I have to really deal with my own stuff, my own discomfort, my own fears, my own feelings about it being taboo, so that I can increase my level of comfort, so that it's easier for couples to bring it up, so that it's easier for me to ask questions. And most people are relieved. I don't know if that's been your experience, that couples are like, oh, okay, finally a safe place that we can talk about this.
Yes. Yes, I think, our topic today is being able to, look at the sexual relationship and ask about it, assess safety, communication, and trust. Basically, so that we're sending them the message that this right here in this place, this is good to talk about. We're going to
Mhm.
work to create a container and a, brave space where we can talk about all things intimate, physical, sexual, affection, emotional, and let them know that, yeah, it's okay. It's okay. You know, Michelle, as you were talking, I was, thinking about how you are pursuing your certification in sex therapy and just wondering how that experience, how you've been finding it, impacting your work with couples.
Yeah, I think the biggest thing is learning about my own bias that I've unknowingly carried around, and my own feelings about talking about sex being taboo. And I mean, so it goes like just even sex. What is sex? Are you talking about intercourse? That it's usually we are very single-minded that it's penile vaginal intercourse and that's sex. Well, what about all the other, what about other
Mhm.
people that are not having sex that way? What about other people that are in same-sex relationships? Like, we're leaving a whole group of people off the table. And what about all the other parts of the relationship? So even that little part alone, like just shifting my language from sex to sex play and intercourse, or thinking about, making sure I'm not excluding people. And when I'm
Mhm.
thinking about and talking about sexual relationships.
Mhm.
So, and then, yeah, thinking about, okay, this is my level of discomfort. Gosh, I wonder what their level of discomfort is. What did they learn about
Right.
sex? Who talked to them? Did anybody, like teach them about their sexual relationship? Was it like fear and shame based? If they were taught anything, or did they just figure it out on their own? Can they talk about it
Yeah.
as a couple? So it just has opened the door to so many questions and so much looking at my own bias and my own kind of narrow um eh, ideas about what sex
Mhm.
was, and like it's still expanding and still growing there.
Oh, I just think that's so meaningful. And I think that's something that we can all, you know, work on. Obviously, it's great if people are doing certification in sex therapy, but as couples therapists, we are going to be, we need to be talking to couples about sex, and we need to be open, and we need to be, able to help them in those areas. So thinking about how we can go about challenging ourselves, accessing our own, inner world biases and experiences and thoughts and feelings about sexual intimacy seems to be an important part of the work. Um, I know we were talking about the SAR. I don't even remember what that stands for, but I know it's a type of workshop or a type of training that helps therapists to explore all sides of sexuality and, access more of that, bias, and trying to kind of understand where their comfort and discomfort, how that lies when it comes to sex. Um,
Yes, I'm getting my training through the Sexual Health Alliance, and they do offer a SAR at least once a year. And I can't remember what the SAR stands for either. So we'll have to put that in the chat, the link below. And yeah, there's lots of trainings that we can take as couples therapists, even if we're not pursuing a sex therapy certification. And I completely agree. It's at least helpful to kind of start to look at it.
mhm,
How comfortable am I talking about sex with my couples? Am I opening that door for them and
yeah.
creating a safe place, or am I leaving that door closed, hoping that they'll open it if it needs to be opened? And if I'm really struggling, where can I go for help? Can
Mhm.
I talk to my supervisor. That's one of the things I love about EFT is it's an ongoing,
Yes. Learning.
ongoing learning, ongoing, like talking to, having a supervisor, working with people who have more experience than you, and continuing to grow and learn. And that's a great place that you can do self with the therapist work. Is like, oh, it's really hard for me to talk about sex with my couples, and I don't bring it up, and I'm not sure why. So these would be great topics. You can do peer
Peer
consultation.
consultation, or yes.
Yeah, so we can, these are areas that we can be intentional about learning about ourselves, and helping ourselves grow and push our boundaries, push our comfort level.
Yeah, and we'll put in the show notes a couple of the EFT master classes that are really good, about, how do you integrate talking about sex and working about with sexual concerns in EFT. There's
Mhm.
2 really good master classes for therapists, as well as, George Fowler and Lori, Lori's
The
wonderful
podcast.
podcast, Foreplay Radio. We'll put a link to that in the show notes also. So it's a really good one, even just to, explore your own reactions to the topics that they talk about. I mean, I think that's been a good way for me to kind of just expand my language and expand, my thinking, with some of their episodes too.
Yes, I think I like that idea of expanding language, because if it's, that's one thing I notice is like, how do I say this? Do I say, what do I say? And when there's so much discomfort, it's really
Mhm.
hard to even sometimes find the words. And just like when I was learning EFT in general, I borrowed other people's language until I found my own language and my own, my own style, my own rhythm. And I think we can do the same with integrating sexuality, integrating, asking couples about sex, helping them communicate about their sexual relationship. We can do that with that as well. We can borrow other people's language that have an ease, can talk about these things easily. So maybe that's
Yes.
one thing we can talk about, is some of the, unless you were going to say something else, the basic questions.
I was going to ask you, Michelle, what are your basic questions for how you assess, the sexual relationship, the sexual cycle for a couple? So yeah, we're on the same page.
Yeah, that's one of the questions I like is, tell me about your sexual relationship. Has this been an area of strength for you? Has this been an area of concern? And has it changed over the years, where maybe at some points in the relationship it was really a strong, a way that you connected and came together, and at other times it became a source of strain. So that would be one of my first questions, that
Mhm.
it feels like a really nice way to ease into it.
Mhm. Mhm.
And it gives space for, it doesn't, we're not going to focus on what's not working sexually. Like, I also want to know what is working well in your relationship in general and sexually. Like, what if the couple really has great makeup sex, and or what if one person really seeks out sex after a big conflict to come back together and to reconnect, and one person's like, I can't go there. We just
Mhm.
had this huge fight, and you want to initiate sex. What are you doing? So, okay, there's a bit of a disconnect there. Let's talk about that.
Yeah,
Another
that's
cut.
such a common, the, issue that one partner needs, or uses or finds sex a really effective way to connect, but the other person needs to feel connected before they can access, longing and desire and the want for sexual intimacy. That's a common challenge there. And how
Right.
about that?
Yes. Another one might be, tell me about your intimacy and your relationship. Are
Mm.
you all affectionate? Do you hold hands? Do you kiss? Do you hug? Do you sit next together on the couch? Do you lay together in bed? Is that something that comes easily for both of you? Something you both enjoy? Because a lot of times there's a discrepancy there. One person's very affectionate and the other person says,
Mhm.
I've just never been affectionate. They always want to
Yeah.
be like on top of me, and I feel claustrophobic. And tell me about your sexual relationship. Is that an area that that you guys are able to come together? Is that affected by this negative cycle that you're telling
Mhm,
me about? So it kind of
mhm.
feels like another way to weave it in that feels a bit natural. And again, it's like, this is something that we can talk about here, something I want you to be able to share with
Yes,
me, something that I feel comfortable as your therapist talking about. How
absolutely.
about you? Are there some questions that help you open the door in the initial sessions?
Yeah. Mine are pretty similar. Yeah, tell me about the sexual relationship, sort of what's working and not working, and how has it changed? How was it in the beginning? How are you making sense of that? How are you explaining that shift, to yourselves? I will ask about, initiation. What's the history with that? Who tends to initiate more? What's that like? um, and especially if it's becoming clear that, I will ask, how important is it that we really work on the sexual aspects of the relationship, now or further on in the therapy? Because I have had couples say, yes, we want to work on it, but right now it is not at the top of the list. We've got to stop fighting every day before, it's even on the table. And I think that's really legitimate. And so, I might just get the lay of the land, talk about how sex fits into the fighting cycle. Because
Right. Are they
remember,
having sex? Are
yeah,
they never
they're
having
all
sex?
related. Yeah. Are they
Hmm.
having, yeah. And when did it stop? And then how did that affect their safety together? And is it part of the negative cycle and the reason they're fighting every day? And the
Yes, the
question often, you
safety.
got to ask that to both, right? How important is it that we talk about sex? Because for one, it may be super important and the other person doesn't even know that it is. And, they may say no. So being able to look at, to remember that it can often be different for.
Yes. And also asking about their communication. Do you guys talk about your sexual relationship? Do you
Mhm,
talk about what you enjoy? Are you able to ask for what you need? Are you able to communicate that
mhm,
you're interested in sex? Are you able to communicate during sex that you're liking something or you need something to change? Are you able to, do you feel safe and comfortable saying no to sex? And oftentimes those simple questions open up so many doors.
yes,
And finding out that someone doesn't feel comfortable during sex to say anything is very important. Or finding
yes,
out that they don't feel comfortable saying no, that maybe there's a pattern of having a lot of obligatory sex.
yes,
And oh, okay. Well, you told me before that your desire has gone down. Did you know that having obligatory sex often lowers your desire, even though you're trying
mhm,
hard to stay, to maybe
yes,
please your partner? Did you know that that's really common, that lowers your desire? So those simple questions open up so many doors and give us so much information. And I love what you said. We don't have to tackle all of this, especially like you said, if there's a really negative, nasty, destructive cycle, which is like eroding away at trust and safety. However, these are important things to store away for us and to know, like, is that sexual relationship causing more trust and
yes,
safety issues? Is it contributing to that? Or
mhm.
is it a way that they're kind of mending along the way, or some of both?
And by asking that question, I mean, even if you're not going to like really focus the therapy on those issues in the initial stages, by asking about it and being curious and helping them explore and label and distill a little bit about that, you are saying this part of the relationship matters. This is the place we can talk about it, right? You don't have to keep this out of the therapy room, So I think, yeah, those questions serve so many purposes. They're really important. So I think
Yeah.
that we're talking about this today. One, I was looking at our list and we had talked just about sexual trauma. Yeah,
Hmm.
just making sure that's on the list, that we're checking in about whether that's something that's impacting the sexual cycle in the relationship. And anything else you think that's important, any thoughts on the sexual trauma question, or just, anything else you want to make sure that we're kind of at least putting on the radar for when you're trying to get a sense of what's happening in the sexual relationship for couples?
Well, one thing I've learned that if their main concern is some kind of sexual issue for one or both of them, that I'm going to need to do a full sexual assessment. And
Mhm.
in addition to an attachment history, relationship history, so that assessment time, if it was one session per person, now it's probably going to be at least 2 sessions for each person, and maybe even 3, and leaving lots of time, because I really need to understand where they're coming from, and to help them with a specific sexual concern. And that might lead into the next part, is when do we refer out? When do we refer
Yeah.
out to a sex therapist? And certainly, if there are things that are outside of your scope, that you haven't worked with before, then I would say, look at referring to a sex therapist. You might at the very least consult with a sex therapist and ask, this is what the
Yes.
couple's bringing in. Is this, trying to kind of sussing it out with another professional? Like, is this
Mhm.
outside of my scope? Is this something that, how would you work with this?
Yes.
And also, I think another one is bias. If a couple comes in and they're exploring having an open relationship, or um, I'm trying to think of other, potential areas where we might
Yes.
have, maybe they're exploring or have explored BDSM. And these are the things that you're like, I don't
Yeah,
know anything
kink is
about
part
this.
of their sex,
Yeah. Or
life, or
right.
any form of non-consensual, not consensual non-monogamy. Yeah,
Right.
that's so important if there's something that you don't feel
These,
comfortable with or know about.
yes. Yes, if you don't know about it or feel comfortable, then definitely refer out, because it's unfair to the client to experience our unexamined bias,
Yeah.
un,
Not their
which
job
is
to
gonna,
educate us.
it's not their job to educate us. And also, like, even if we do our very best not to judge, it's just almost impossible to keep that from happening when we don't
Yeah.
have the education, or we haven't explored our own bias.
Yeah.
And that's really not fair to the couple, or the individual, when there's lots of people that can create lots of safety, that have lots of knowledge, and we can refer those folks out so that they can get the kind of care that they deserve, because everyone deserves to be seen and heard and not experience shame or judgment, right? And
That's so great. Yeah. Yes.
are there any other areas where you can think of that we might refer out, or that couples therapists might?
Well, I do think where somebody has a sexual issue that does sort of meet the criteria for, um, specialized treatment like vaginismus, um,
Mhm,
you know, that can be, sometimes some of the, ejaculation disorders,
mhm,
it can be helpful to have somebody who's really familiar with the standard of care treatment, best empirically supported treatments for those.
mhm.
And that's one way
Yeah.
I refer out.
Mhm. If one of the partners is having some out of control sexual behaviors.
Yeah.
So yeah, there's definitely specific things that, I'm sure we know as clinicians, right? Whether or not that's outside of our scope. So if it's outside of your scope, there's no shame in that. It's just, of course, there's things that are outside of all of our scopes. We can't
Right.
be experts in everything. It's impossible. And that's why this is a good thing we don't have to. There's other people that are trained.
Mhm.
And I guess since we're wrapping up here, I think maybe one thing I'd like for people to stay with is just to maybe look at examining what's my level of comfort.
Mm.
And if my level of comfort's super low, where could I reach out and start to talk about this with with a peer, with a supervisor, to help,
Mm.
increase your level of comfort. And also, we'd love to hear in the um, notes, maybe you can share with us what's one of your great questions that you use to open the door to couples feeling comfortable talking about their sexual relationship in your sessions. I'm sure you guys have great ideas.
Yeah, we'd love to hear it. Please leave a comment. And also let us know if there's any topics that you're thinking about that you'd like to have us, join you in and talk about it in a future video.
All right. Thanks, everybody. Bye-bye.
Bye-bye.